The ANRS site in Vietnam was officially created in January 2000, 4 years after the signature of a first collaboration agreement between ANRS and the Vietnamese Ministry of Health. ANRS has also formal collaboration agreements with two medical universities of Hanoi and Haiphong. Until 2017, the activities of the site were coordinated by Professor Trung Thi Xuan Lien from Ho Chi Minh City Pasteur Institute and Professor Françoise Barré-Sinoussi from Institut Pasteur in Paris. They were then succeeded by Professor Phan Thi Thu Hung, Vice Director of the Vietnamese National HIV Control Program, and Dr. Didier Loreillard, practitioner at the University Hospital of Nîmes. They are assisted by two deputy coordinators, including an international technical expert appointed by the French Ministry of Europe and Foreign Affairs. More than 30 research projects were implemented to improve prevention, screening, diagnosis and care of people infected with HIV, viral hepatitis, and related diseases such as tuberculosis, in line with the priorities defined by national programs. Through project developments, the network of French and Vietnamese researchers expanded and now includes a wide range of disciplines and backgrounds. The coordination office of the ANRS Vietnam site is located at the Vietnamese National HIV Control Program of the Ministry of Health. Two coordination centers for ANRS-funded studies have been established in Ho Chi Minh City and Haiphong with capacity building, knowledge transfer, and the promotion and funding of master and PhD degrees.
The collaboration with Vietnam started by training and technology transfer, first in virology, then in immunology and clinical research. One of the first research studies we did allowed the identification of the main HIV-1 subtypes circulating in Vietnam. We then started to be interested in the main population strongly affected by HIV-1 in South Vietnam, the IV drug users. We made a study in order to find out what was the main obstacle for treating this population by antiretroviral treatment. This study allowed the implementation for the first time of antiretroviral treatment in Vietnam and was followed by ESTER, PEPFAR, and Global Fund programs.
In 2010, to facilitate the implementation of clinical trials on HIV-TB co-infection, Dr. Didier Loreillard set up a clinical research unit at Pham Ngoc Tac Hospital in Ho Chi Minh City.
When I arrived in June 2010 in Ho Chi Minh City as a technical expert for ANRS, because two clinical studies concerning tuberculosis and HIV co-infection were planned at Pham Ngoc Tac Hospital, the director invited me to be based in the hospital and asked me to help them to build a clinical research unit. This was the beginning of an exciting adventure, where we shared experiences and knowledge with the hospital staff on a daily basis. We have succeeded in creating this clinical research unit, and in less than 10 years, Pham Ngoc Tac Hospital has participated in 4 ANRS international randomized clinical trials on TB-HIV co-infection, including in children, and which have led to major results and international scientific publications. Pham Ngoc Tac Hospital is still a privileged partner for research on tuberculosis, and particularly in people living with HIV, and probably for several years.
In Vietnam, the HIV epidemic is concentrated among key populations, starting historically with people who inject drugs. From 2014, ANRS supported the Vietnamese government's initiative to reduce HIV transmission among this high-risk group by co-funding the DRIVE research program in the city of Haiphong, together with the US NIDA and the Global Fund. DRIVE demonstrated for the first time that it was possible to stop HIV transmission among PWID in a resource-limited setting through a community-based intervention. The DRIVE initiative has created a multidisciplinary research platform in Haiphong with a strong partnership with local authorities and civil society. It has provided the basis for the development of other community-based studies on access to diagnosis and treatment of comorbidities such as hepatitis C, TB, or psychiatric disorders in the same population. The results of the DRIVE study were presented to stakeholders, development partners and donors, and the model has been replicated as an intervention program with Global Fund funding from 2021 in 15 provinces in Vietnam and extended to men who have sex with men. The ANRS Vietnam site also organizes its International Scientific Days, represents France in events organized together with civil society and key populations affected by HIV, and participates alongside the French Embassy in the country coordinating mechanism of the Global Fund. Following the creation of the new ANRS Emerging Infectious Diseases Agency in January 2021, the activities have been extended to research on COVID-19. While continuing its current research activities, the Vietnam site will add new themes in the coming years in line with the local priorities in the field of emerging infectious diseases by integrating the One Health approach.
ANRS-funded projects have facilitated and transfer and application of new technology in HIV/AIDS-related scientific research, care and treatment of HIV patients, making contribution to improve the quality of health services in Vietnam, and workforce capacity of warn agencies, as well as promoting Vietnam integration into regional and global research networks. The establishment of the ANRS MIR with integrating emerging infectious disease is appropriate to the current epidemic context in Vietnam. The Ministry of Health welcomes the renewed urgencies and will work closely with ANRS MIR to provide maximum support for the implementation of not only research on HIV/AIDS and viral hepatitis, but also emerging infectious disease, especially current COVID-19.